Thank you. Welcome to Health Programming at your library. My name is Jamia Williams, and I am the Consumer Health Program Specialist with the network of the National Library of Medicine's training office. Okay, so when you think about health programming for your community, which picture best closely resembles how you feel? A is hands planting seeds in the dirt. B is a raft in white water. C is a large maze. D is a ballet dancer. Put your response in the chat, and if you're up for it, add a little note on why. Okay, we have A, D, A, C, you're not. A lot of A's. C, lots of different directions. C's is something we could grow, so A. A, we are just getting started. Yes. All right, thank y'all so much for participating. We all bring different feelings, experiences, and expectations about planning and implementing health programming in our communities. The class is not a full how-to, but will provide information and resources to support you in getting started or getting new ideas in this area. In this session, we will discuss the purpose of conducting health outreach programs for libraries, create an initial plan for the development and implementation of health outreach programming in your library with ideas and examples from big to small. Identify potential partnerships for health programming and outreach in your library. Identify resources from the National Library of Medicine, NLM, and other reputable agencies that can be used for supporting the implementation of health programming in libraries. I briefly want to introduce the network of the National Library of Medicine, also known as NNLM. As the name suggests, the NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally to get to know communities on the ground and helping those communities serve the people they know best. But we are also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. This includes both working with organizations like libraries of all types, schools, healthcare, and all sorts of community-based organizations. We do this primarily through three different methods. One, providing funding to organizations so that they can work within their own communities. Two, other forms of outreach and engagement. And then like today, we offer a wide range of training and education opportunities. At NNLM, our mission is to provide equal access to biomedical information, to health information professionals, as well as access to quality health information for the general public, so they are better able to make informed decisions about their health. These are the resources that you will need for today's session. The handout has links and activities to allow you to follow along to start planning your health program. It is not required for you to complete. And Sam shared those links in the chat for you, the handout and the slides. So let's start with input from you. The spectrum of ways to incorporate health outreach and programming is very wide. An example of outreach is a library partnering with a local nonprofit to provide free menstrual products. Health programming might include a session for seniors about how to find reliable health information online. If you have seen anything lately that caught your eye, tell us about it in the chat. You're not seeing the links in the chat. Oh. Oh, Sam, can you share it to everyone? I think you just sent it to me and the panel. Yeah, just us.
Sorry
She'll,
about that, everyone. I will send it again.
all right, thank you. Thank you for letting us know about that. She'll reshare the links. So why might libraries conduct health outreach? Libraries are often community hubs with public libraries across the country, receiving up to 4 million visits per day. Many consider libraries to be trusted providers of information and community resources, including health information. The Pew Research Center in 2016 reported that 38% of people using libraries did so to seek out health information. Libraries have existing partnerships and hopefully local resources that are in tune with the needs of communities. Thank you for sharing examples of health programming that you have seen lately. We see some good examples. Keep sharing. One reason to offer health outreach in your community is that in today's complex information environment, we have a greater responsibility to communicate the resources and expertise that exist in our communities. Libraries, community centers, and faith-based organizations are often heavily utilized when someone has a question on just about any topic. They are often the starting points for information seeking on various topics, including health. Providing current and timely health information enhances the image and visibility of the library or organization in the community, while offering health programming helps keep the library at top of the mind and relevant to users. Adequately preparing for health programming and outreach means that you stay in tune and to the current health needs of your community. Health events and resources increase visibility and inevitably show your overall value to community members and leaders. Just a quick note to recognize where we are today in the health outreach and programming landscape. We hope that you will enjoy learning about some resources and projects. Library people are ambitious people and find some inspiration, but we hope you don't feel overwhelmed or compelled to do all the things. Many of you and your colleagues are experiencing challenges like staff capacity, funding insecurity, social and political pressures. All of these play into what you can and choose to offer in your setting. If health outreach is new to you and your library organization, it may be helpful for you to begin by locating information on your community's health needs. This is the first competency of the Consumer Health Information Specialization from the Medical Library Association, MLA. Learning about the demographics, health issues, strengths, and challenges of your area can help you better meet the needs of your community and programs that align with the needs of the community that are more likely to impact where you are. Also, grant funders like NNLM require justification for funded program activities, so it's good to make sure your projects are in alignment with your community. I'm a firm believer that librarians and community advocates are uniquely in tune with the needs of their communities. But one step to planning health outreach is knowing where to find quality statistics to back up what you might already observe or feel about your community. I'm going to give you an overview of 3 resources to learn more about your community. We'll look briefly at all 3, and then I'll give you some time to explore. State Health Facts provides free, up-to-date, and easy-to-use health data for all 50 states, the District of Columbia, counties, territories, and other geographies. Data available on State Health Facts comes from a wide variety of public and private sources, include Kaiser Family Foundation reports, public websites, government surveys and reports, and private organization. This resource focuses on providing information at the state level. If you're interested in offering a program on diabetes, for example, you can find information on health status indicators for your state on diabetes and information such as the percentage of adults who have been told by their doctor that they have diabetes. The second resource is the County Health Rankings and Roadmaps. A service from the Robert Wood Johnson Foundation is another excellent place to start looking for information about health issues in your community. As you might guess, this website provides health data at the county level. Choose your state and county, then scan through the data to get a sense of the information provided. I pulled Salt Lake City, Utah, because that's where we're at the NTO, the National Training Office. In the upper right, this graphic tells me how my county fares compared to the rest of Utah and the rest of the United States. Salt Lake City has better health outcomes than the average county in the state and in the nation. Below, I've selected a particular health outcome, premature death. You will see a definition of the health outcome, followed by how recent the data is. Also notice an itty-bitty graph icon. You can further explore trends in the metrics. Some metrics you can disaggregate by race and ethnicity to examine for health disparities. Here's one more snapshot of the county rankings and roadmaps. Near the top of the table, there's a checkbox for show areas to explore. Clicking the box will highlight any red flag areas in the county that are potential challenges to health. Make a note of these and any other areas that stand out to you. You can also find areas of strength. For example, if libraries need to justify the need to purchase materials for a program on a given topic to library boards/trustees, local municipalities, you can use the county health rankings and roadmaps to locate information on your county and compare to other counties, and state that there is an identified need to raise awareness on a given topic. And finally, narrowing down a bit more is the third and final resource is the City Health Dashboard, which allows you to see where the nation's 500 largest cities stand on a 36 key measures of health and factors affecting health across 5 areas, including health behaviors, social and economic factors, physical environment, health outcomes, and clinical care. These categories align with those used in the county health rankings and roadmaps. In this case, I pulled up the air pollution metric. The bar shows you how Los Angeles compares to the other counties in the dashboard. It notes that a lower measure in this case is better and will include a green check mark in the value is better than the average. One thing you can notice here is that while Los Angeles as a whole has only slightly worse air pollution than the other cities, certain census tracts are subject to notably higher air pollution. These dashboards are rich. You can look at a city overview to see how a city is doing compared to the others in the dashboard, and then zoom in on a particular aspect and get more detailed geographic or demographic information. Here I have Charleston, South Carolina, home of Region 2. Overall, Charleston has reported lower incidence of high blood pressure than other cities, but the map allows you to look more closely and see where community can be improved. Okay, so I know you are eager to check these out. So pick one of these resources that I just mentioned to explore and learn about your area for a few minutes. Come back to share what you used and what you learned, or confirmed that you might already know this information and can help inform your health programming you would like to offer. I'll be quiet for about 5 minutes. All right, thank you so much for your engagement in the chat already. I'll read some off. So I'll start from the top. Someone said, I use these resources frequently. They're awesome to help nursing and help students as well as community members research health and wellness in our cities, county, and state. I also use them when applying for library grants related to our community's health and wellness. And also a connection was being made in the chat. I love to see that. Thank you so much. So y'all will connect about how you're proactive in doing that. So thank you. I have used all of these resources before in another NLM course. I really like the City Health Dashboard. This is something I can point out to nursing students for areas to look into for specialization and such. Someone else put county health ranking and roadmaps for mental health resources. I have used these resources for NLM CHIS classes and grants. Very useful. Thank you. Someone else put, I'm surprised to learn our county has a low number of primary care doctors. Our city doesn't have data in the city site. Yeah, that's mainly for major cities, so it could be why yours isn't listed there. Let's see, communication tips, being informed about medications, being proactive about selecting one's healthcare team. All these are aspects that help consumers advocate better for themselves. Yes, so true. I can use the county health rankings for class assignments. Really like the state facts. Helps determine some ideas for programming ideas in critical areas. We have not used these a lot here at our college. Not surprised on the data for Dayton, Ohio. In addition to the 3 resources, my county has a website that complements the information provided on them. I encourage everyone to check with their local health departments and see what else is available to help tap into their communities. Yes, I definitely agree. So the county website was shared there with some information. And many counties have a community health improvement plan published on their website. Yes, many counties do have that. And as information professionals, if they have any task force or any committees, that's another way for you to get involved and to help with collaborating with those with your county and also see what organizations are a part of that. I do that personally where I'm part of different organizations and coming together as a county to help with our better to help improve our health outcomes in our area. So that's another thing you can consider as well. Let's see, I've used some of these resources just by virtue of going through CHIS, love the stats and enjoying the county data. Nashville is doing better than I thought it would. Okay, well, some people are surprised, pleasantly surprised, and some people are shocked by some of the things they're finding. So thank you for sharing. I appreciate it. Keep them coming and keep connecting with each other. Thank you so much. So once you had a chance to review your community health needs, where do you even begin? For your initial planning, first, identify your intended or primary audience, then consider the type of outreach or programming that is appropriate for this audience. Keep in mind, health outreach does not mean that you have to provide a 1-hour program with a speaker and activities. Think about the spectrum of engagement and what a manageable and meaningful outreach activity might look like based on your primary audience's needs. It might be highlighting particular information resources. It might be offering a one-time or ongoing programming, or it might be offering some training. There are many other options too. Finally, consider the staff and physical space you have available and other factors. There are a wide variety of programs you can offer to address the health needs of your community. These are a few categories to get you started. There's food access. So can you do a pantry, cooking program, gardening, movement, hosting a physical activity, walking, yoga, including chair yoga, injury prevention, access to care. So partnering with vaccination clinics, diabetes education, smoking cessation, support groups, chronic disease management. There's social work, so embedded social workers or collaborating with social workers in your area. Technology, there's telehealth services and digital literacy projects. Children and families, there's sensory story time, music, movement, etc. Veterinary, so vaccination, pet first aid, pet loss and grief. Promoting information and reference services collections, so a curated list of key or sensitive topics. The pictures on this slide share a couple of examples. So we have the Carnegie Library of Pittsburgh. It offered bookmarks to help teens find materials on sensitive topics without having to ask a library staff member. We have Penn Hills Library. They had a food pantry. Teen Hygiene Health Center at the Rockwood Makerspace in Oregon. Central New York Library Resources Council, they had the Healthy Pet Project, which included workshops on how to prepare for disasters with your pet. Yes, thumbs up to the sensitive topics list. I thought that was an amazing idea. So a very important and easy way to provide information. So hopefully those ideas are fueling some of your own. Consideration as you are evaluating ideas. So when making the case to offer health programming, think about the unique needs in your community. In addition to your intuition and observations, gather evidence, knowing that administration, community leaders, and funders will expect evidence of need. It is easy to always chase big, bold projects, but simple ideas and services are a good place to start and easier to maintain. A simple question: is this project, idea, or program easy to explain to others? That will help you garner support. Caution: avoid competitions, especially those focused on weight loss. Know who you are inviting. Sales: companies that sell supplements, diet plans, or unproven cures may be interested in finding an audience or space in the library. For example, registered dietitian and nutritionist are not the same thing. Anyone may call themselves a nutritionist. A registered or licensed dietitian is a recognized medical professional who has passed a national exam. Furthermore, there is a spectrum from weight loss focused practice to healthy at any weight philosophy. So those are some things to keep in mind. When working with new partners, authors, and speakers, consider a spectrum of opinions and care. And the big thing there is the care piece. More inspiring ideas. Recent Newsweek article feature how libraries are becoming health hubs, food, fitness classes. There was a public library that partnered with the American Heart Association to have blood pressure readings. Cobb County, Georgia events in December 2024 included partners to offer yoga, vaccines, and Medicare counseling. And as someone said, they have a seed exchange and community garden in their system. Both are very popular. I bet. Yeah, gardening is amazing. If these stories don't have your wheels turning yet, we have more ideas and sources for you. Some of you may already have an idea for the type of programming and outreach you want to conduct, but if not, let's go get some ideas. I will briefly describe these websites and then invite you to explore on your own. So Let's Move in Libraries has program ideas, resources, and examples of library programming focused around movement and active living. Advice for where to begin, accessible programming, and liability, which I think is very important to provide accessible programming and make sure that you're covered and you have liability there. So ALA Programming Librarian is another one. Browse and search library programming ideas. It provides examples, includes a search by budget, by age group, and also you can search for health topics. So you can get tips on planning, partners, marketing, budgeting, and other advice for carrying out the program. It's an incredible resource. WebJunction. Health happens in libraries. You can check out the resources list there. This is less a list of ideas and more dedicated resources for you to develop health programming. So there's included webinars, communication ideas, detailed examples of projects. It is deep resource and very much worth exploring to make your health programming a lighter lift for you. And it includes resources on things like sustainability, helping your library be autism ready, creating a garden program or community pantry, and much more. And as someone mentioned in the chat, they have a garden program and seed program in their system already. So Rural Health Literacy Toolkit. It's a programming clearinghouse specifically dedicated to rural libraries focused on health literacy. Ready.gov is emergency preparedness training and programs, social media toolkits, Jayberry story time resources. It talks about food there, movement, etc. for story time with children. So if you have a library where you support children, this will be a great resource for you. And then we have the NNLM past funded projects and current funded projects, and it describes the target population and projects and past projects. Lastly is the National Health Observances. So it has toolkits and resources from the Office of Disease Prevention and Health Promotion. These fall more in the raising awareness category. Can we have a list of these resources later? My computer won't let me take a screenshot. So earlier, Sam provided the document with the handout, sorry, that has the links there. So on the handout, there's active links that you can click on and take you to each of these websites. So you don't have to take a screenshot. So it has all that what you need, all the links and resources there in the handout for you. And if you have issues with that, let me know. We can email you that separately. Also, it should have been emailed to you prior to today's webinar as well. So let me know. All right, thank you for the links. You're welcome. All right, so now it's time for activity 2. These are linked out in your guide for today, just like I said, because not everyone will be interested in the same types of programming. We're going to give you a few minutes to explore one or two of the resources that are appealing to you. If you don't already have a project in mind, find an idea that you can use for the remainder of the activities today. So choose a resource, find an interesting or promising idea for your community, ideally related to a need that you noticed or found in activity 1. I will be quiet for about 4 to 5 minutes so you can explore, and I will invite you to share which resource you used and what you found in the chat. All right, thank you so much. Such great things I'm seeing in the chat. And if you have not yet shared, please feel free to share. Okay, so I explored the Let's Move in Libraries link. Wow, there's just so many wonderful ideas. We completed a community survey 6 months ago, and our community was asking for these types of activities. I love the parks partnership. We already offer story times at our local park during warm weather. There are some great ways to expand on that program on the website. Oh, that's amazing. Yes, I love seeing partnerships between libraries and parks or libraries and museums. We have that in our local county. It's amazing to have that. National Health Observations, June 27th, HIV testing awareness. STI is not talked about as much as they used to, but more bus ads are popping up to raise awareness of STIs. Customers with HIV come to the library. Good idea to focus on that here at my branch. National Health Observances, practical, easy to access tool, search suicide prevention and disasters, good resources and links. I really like the Montana Health Literacy Month Toolkit. It gives me ideas to partner with a few different programs. Thank you. Someone explore Let's Move in Libraries, story time for all ages, National Health Observations. Someone said, somewhat disappointed in the National Health Observations for trying to do advanced planning. All right. It will be great to start a walking group and yoga class. That'll be very great. And there's a lot of organizations that do walking type of initiatives and programs, so you can always partner with them. People are already doing the work or doing the walking and the yoga in your area and just collaborate with them. I think that's a great idea. Uh, Someone said I use WebJunction and think it's for people who are just starting to connect with health programming. I really like the Let's Move site. A walking path through the library would be interesting. We have 3 floors at my branch and a huge staircase. Oh yeah, that'd be great. A walking group that listens to ebooks. That's an amazing idea. That's an amazing idea. I think someone shared that idea last year. They do walking and they listen to books as they walk. Great idea. Like a walking book group. Yep. On WebJunction, it talks about social isolation. Yes, if you haven't heard, that is one of the things that is prevalent in the United States is the epidemic of loneliness. So that is definitely a consideration is to pull people out of that and to bring people together in a different way. So they say we already partner mostly seniors with our tech teens, maybe finding more ways to partner with these true groups together. Yes, I have seen a lot of people doing that, putting seniors and teens together because they deal with isolation in different ways, but both populations can deal with that same issue, which is loneliness and isolation at times. I thought the National Health Observations needed updated, but great for social media posts and promoted related books on displays. All right, thank you. Keep on sharing. Okay, with an audience and idea in mind, begin to think about who you might be able to partner with to enable or enhance the outreach or programming activity. Partners may have the expertise, audience experience, materials, or other resources that your program needs for success. Partnerships, one effective way to do health programming is to partner with a local organization who needs a location or a space and goals that align with yours. Sometimes they reach a bigger population by coming into the library. Types of partnerships to consider: your local government or public health offices, the library of your community college or university, or if that's where you are, your local public library, healthcare providers, food banks, agricultural nonprofits, SNAP educators, cooperative extensions might do programming on food safety, nutrition, mental health, aging, and more. Anyone to work with yours. So there's always local authors and businesses to consider as well. Any other potential partners you add to this list for health programming, share your ideas in the chat. Here's one example of a partnership. At Brooklyn Public Central Library, the young adult librarian right, Rakisha Kearns White noticed a need in her community. Many young people experiencing period poverty. According to period.org, in 2021, 23% of young people in America struggled to afford period products, and 16% of students had to choose between buying pads and buying food. Statistics shows that students of color, lower income students, and those living in rural areas are most impacted by lack of access to menstrual hygiene products. The library partnered with a nonprofit called the Cycle Alliance to start up a period pantry. This resource provides that resource provided products and surrounded it with educational materials and information about reproductive health. Here's another example where a community need was identified and a library developed a project, fund partners and funding to meet those needs, found partners and funding to meet those needs.
In Pottsboro, Texas, a rural community 90 miles north of Dallas, people have to travel to get to the doctor, and that's difficult for a lot of people here, and it's time consuming. There's no public transportation, nor is there any ride sharing available. So we stayed open throughout the pandemic so people could come here because people didn't have computers or internet subscriptions at home. Then we started getting a couple calls from people who wanted to have doctor's appointments. Libraries are perfectly positioned to work with telehealth because we're oftentimes the fastest internet connection in town. People trust librarians. It's a neutral space. We're accustomed to helping people with digital literacy skills. So it all came together to request funding to start a virtual health room here.
The original proposal that they pitched was to create a pilot telehealth site that would allow them to figure out best practices that they could distribute as a model to other libraries or other community organizations that are looking to do the same thing. And in that respect, it has been a resounding success. A crucial partner in this was also HSC Health, which is sort of the clinical support that they got for managing schedules, for setting up appointments with providers.
So as it stands right now, there are 77 counties that don't have a hospital. Telemedicine can be a real solution to a lot of these problems if we have both the equipment, and then you have to have someone special there to help lead the way and to acknowledge that it's actually safe.
NNLM made it possible for us to convert this old storage room filled with old books into a virtual health room, a room where people can come in, connect with healthcare providers, get the care they need closer to home. It's leading to people being healthier.
During COVID, I did not want to go sit in a doctor's office and expose myself to bigger things when I just had a minor health issue. So this made it where my safety came first, and it was private, easy, convenient. That's why I chose it.
It's a great model, and in fact, we've created a playbook because this is not about secret sauce. This is about let's make our communities healthier. Here's what we learned from this experience, and here's what we wish we had done a little bit differently. How fabulous would it be if all rural communities had this kind of access? Healthy people become healthy communities.
Whenever Pottsboro, Texas is on national news, I know we've done something worthwhile. And I am proud of being the first pioneer to do this, to be able to help other libraries across the country make this happen. And it's a reality now that would not have happened without NNLM.
All right, that was a great story about finding your funders and getting your idea put out there. That is amazing. Yes, thank you so much. I want to know that someone mentioned earlier about partnering with local artists, and I want to amplify that because that's a great idea, especially if you have a way to renovate, like if you're doing renovations in your library and there's room for you to have like someone put like a mural within the library or outside of the library building, and partnering with local artists is a great way to do that. And I know we had a local artist here partner with the library, and he did the inside and the outside of the library space and also offered lessons to local youth. And that was an amazing partnership and opportunity. So thank you for sharing that. It just brought back good memories of those good partnerships that you see in your local libraries. So after you get your community health statistics and you have brainstormed some ideas and partners, it's time to fill in the details to help your idea be realized. I'm going to share 2 ideas for formatting your plan, and then you can choose which aligns best with your organization. The first method is 7 key questions. To help you get through the development of your activity, there are 7 key questions you ask yourself. These questions are all multifaceted, but can help you recognize what pieces you have in place and where you need to fill in the gaps. So the who. Think about who your primary audience will be, who in your organization can assist in the planning and the program, who in your community might be an expert or might know an expert. Who are potential partners for this outreach event? What? What type of outreach activity do you wish to provide? Will you provide information or will you offer a program with a speaker? What are the community health needs and what evidence of this do you have? What resources are available from the National Library of Medicine or other agencies that you use? When? When will you offer the program? When should you schedule so that your audience and staff are available? Is it a one-time event? Should it coincide with a health awareness month? Is it ongoing? Where? Where will the program be held? Do you have the space? Is it a kit to take home? Could this be outreach to a senior center or school? Is it accessible to the participants? Why? Why do you want to offer this outreach activity? Why will this benefit your library/organization's community? How? How will you market the program? Are there specific locations where your ideal audience frequents? How will you locate speakers if you are unaware of any? How much? That's the big question. This question involves looking at how much time. That's one of the how muches, how much time you and other staff will have to invest in the activity. And also how much money will it cost? Those are big consideration. Okay, that is a lot. I'm going to share one more planning tool, and then I'll give you some time to work on your own. If you need buy-in from funders or other stakeholders, one way to explain your program or activity is through the use of a logic model. Use the reactions to let me know if you use a logic model or not. I will say yes, I have used a logic model before. A logic model is a visual representation. Someone said yes, thank you. A logic model is a visual representation of a program that illustrates how planned activities are linked to program results. A well-constructed logic model can make it easier to plan outreach programs by helping you determine the resources and activities you need to achieve desired results. As complicated as logic models may sound, they can be easy to use and very helpful from program idea to evaluation. At the very top is the goal of your activity or program, and you think of the inputs as the resources that will be used to support the activity or program you wish to conduct. The activities are the main things the project will do/provide. The outcomes are how many and what sort of observable/tangible results will be achieved. The short term focuses on what will occur as a direct result of the activity, such as changes in knowledge, skills, or attitudes. The assumptions are the beliefs about the environment and community. External factors include the positive and negative influences, the culture, economics, politics, and demographics of the community. Both assumptions and external factors should be confirmed before implementing the program. This template shows the types of things you might include in each area. For example, your inputs include time, money, equipment. Activities, what will you do? Will you print bookmarks, provide a class, host a blood pressure screening? Your outputs might be that people have increased knowledge about evaluating health websites and that they then will help their family members separate reliable information from questionable information, or that they know their numbers. Logic models don't have to be daunting. This is a simplified example for children's story time from the Library Research Service. You can think of them as a bit like if-then statements. If we do/have the things on the input/activity side, then we predict the outcome side will happen. For this type of logic model, you can start with your goal and long-term outcomes and work your way back. In this case, the desired outcome is that caregivers and children learn early literacy skills. To get there, you're going to host a story time on early literacy, which is your activity, with an aim of 15 attendees. To do that, we need staff time and supplies. If this way of planning appeals to you, there are many resources on developing logic models. So, activity 3, your turn. Choose either the 7 questions or the logic model from your class handout and begin filling in the key pieces to implement your idea. I'll be quiet about 4 minutes so you can start filling in the details. All right, and I'm back. So we had a question in the chat. Can you point to a framework of the spectrum of engagement? I think that could help me generate ideas of different types of activities at different levels of engagement. I don't have a framework of what that entails, but basically the idea is like from small to big, like creating even though creating a bookmark can be somewhat of a task, but it's smaller in the sense of less time, less money, things like that. So something where it's like more something where people can engage with it at their leisure, or something where you're intentionally engaging with folks and it requires like more time, more money, things like that. So just that idea, and the resources that we discussed in the last activity, I feel like will help you with that, whether you want to go from something from small to big. So whether if you want to do observe one of the National Observation Months and just have, like a lot of people do, pull out all the books that you have about that National Observation Month. That's something that, is small on a scale on the scale to small to big. But yeah, I don't have, unless someone that's attending the webinar today has an actual framework to point to, I don't have necessarily a framework, just the level of engagement is what we're drawing from. So, oh, thank you, someone hearted that. So yeah, so that's what we mean by that. And if you still need more clarification, please let me know. All right, so let me know, did you try the 7 questions or did you try the logic model for this activity? 7 questions, yes. 7 questions, okay. Logic model, okay, logic model. All right, thank you for sharing, and hopefully you started plugging in those areas in the models and get started on planning your health program. Okay, I use the 7 questions as it was better suited for my project. I use the 7 questions model and compared it to what we are already doing to help our homeless patrons. Okay, cool, thank you. Yeah, I pushed myself to use the 7 questions ones because I'm used to using logic models and I wanted to try something different. So thank you for sharing. All right, now that your program or activity is coming into focus, we'll touch briefly on how you will get to the folks you want to reach. What marketing ideas have you already used or have seen that you might like to use? What works best in your area? That's very important to consider. So I would love to hear from you. So share your ideas. What do you use or what have you seen in regards to marketing? I know a lot of people use social media, so there's people using all different types of platforms in regards to that. How do you market? Library e-newsletter? Oh, yes, yes. Those are very effective. I know last year I was working with one of our local branches and I was passing out flyers. So I would stop at local businesses in the area and pass out the latest library events. So that was cool to do. So that's one way to do that. Utilize people in your community to hand out those flyers. Someone said we use flyers and word of mouth. Need for homeless help is strong at our branch, so the patrons usually tell each other about our programs and when to come and see our partner organization. Yes, word of mouth is very effective. And when you tell people, sometimes they show up and you're like, wow, you actually showed up and you brought a friend. I love to see that. We mainly use flyers and social media, but word of mouth from patron to patron seems to always be the most effective. So true. The digital whiteboard by the interest has really boosted attendance. Yes. And I love seeing people on the whiteboard use the whiteboard to ask a question, and like the different responses sometimes could be funny and sometimes, serious, but that's a way to engage people too. It's very effective, that whiteboard. You have a digital whiteboard, but I've seen like just a regular whiteboard has been cool too. Okay, flyers, social media, websites. Let's see. In a rural area, there's a strong evidence for flyers, word of mouth. I'll be incorporating these methods in my marketing. Unfortunately, branch libraries get the short shaft when it comes to marketing compared to the main library, very limited and obsolete marketing methods, so flyers and nextdoor.com. Okay, yeah. Organizations that we partner with can advertise as well as us with program flyers and slides on our website's eBlast. We use social media, flyers, website. Makes sense to go to various health clinics to promote and drop off flyers. Yeah, that does make sense. Website, library e-newsletter, social media, flyers and handouts. In the library, staff to promote patrons that they're in the building. Working with the city if they have a neighborhood/community program. Very good idea. Whiteboard is so great with college students. Yes, that's where I've seen the most in college students. They have a very good sense of humor. So using that whiteboard. It's been some funny things on there. So, all right. So a couple brief notes about publicity and marketing. Once you have determined your primary audience and type of activity to consider, what agencies in the community does your intended audience frequent? So like the rec center, the senior center, schools, what areas of your organization are they most likely to be in? It can sometimes be a process of trial and error to determine what marketing strategies work best for your particular community. Some ideas include the traditional use of flyers, as people mentioned, or signage on the bulletin boards and in windows of local businesses. Additionally, information can be listed on website calendars, press releases, newsfeed, and the use of social media sites. Remember, marketing doesn't mean you have to be restricted to the walls of your library. Place bookmarks in local health clinics. Have flyers about up-and-coming lecture series or database searching classes in grocery stores, hair and nail salons, child care centers, community and faith-based organizations in your neighborhood. In a library setting, it might even be useful to place additional signs about an upcoming health outreach event right in the stacks where health materials are. This way you can catch a casual browser. Don't forget the power of word of mouth and personal invitation, which a lot of you mentioned in the chat, is very powerful. Two resources listed are the Public Libraries Association Marketing Strategies page and the ACRL Library Marketing Outreach Guide that you might want to explore. Also, some of the idea sources listed earlier, like the Programming Librarian, include marketing ideas. The Libraries Transform initiative was launched in 2015, and it focused on increasing the public awareness of libraries and the critical role they play in transforming lives and communities through education. The project itself has been retired, but many assets for the initiative are still available on I Love Libraries website, and it includes graphics, key messages, and activity suggestions. And NLM partnered with ALA for the Libraries Transform Health Literacy Toolkit, and the wide-ranging array of health literacy topics covered were nutrition, aging, and chronic illness. These are numerous resources available in the toolkit that will speak to the different types of health and other outreach that you do in your library or community agency. This is both a resource for promotional graphics and activity ideas. Oh, thank you so much. So creating programs from scratch can be a lot of work and worthwhile, but sometimes having a jump start is just what you need to get going. Next up, I'll share with you some resources from NLM and NNLM that can help you put together health-related programming with a little head start. First up is the National Library of Medicine Traveling Exhibitions Program, which are made available free of charge to the public, university, and medical libraries, as well as cultural centers around the country. Okay, raise your virtual hand if you hosted or seen one of these on display. Okay, I see some raised hands. Oh, yay, you're preparing to host one of these exhibits in fall 2025. Yay, 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 yay. So the traveling exhibition is comprised of about 6 freestanding banners, which contain information about their particular topic, but the main information is online. The banners provide an opportunity for related programs or to highlight your services. NLM also has resources for how to create programming around the exhibit that you host. The exhibit you see here is called For All the People, a century of citizen action in healthcare reform, and is also available in Spanish. There are also online resources connected to the exhibitions that include multidisciplinary educational and career resources for educators and students in grades K through 12 and in college and universities. These include extensive lesson plans for multiple disciplines from history to science. There is a shipping fee for the physical banners. You can contact your NNLM Regional Medical Library to inquire about funding sources. The NLM exhibition program link will be placed in the chat, or you can also, it's also in your handout. This is an example from the traveling exhibit Graphic Medicine 3, Conceived and Well Drawn. It is about the use of comics and graphic novels as a form of communication about health. It features Adolfo and several other graphic novels focused around health narratives. University of Pittsburgh Health Sciences Library, as a part of their exhibit, they feature books and a drawing competition and invited a biologist and cartoonist to give a lunch and learn presentation. Some of the exhibits focus on health professions, other on historical and current health issues. This screenshot is from the online exhibit for Surviving and Thriving, AIDS, Politics, and Culture. This online exhibit can be used independently of the banners. In some, you can use the banners alone, just the online exhibits, or a combination of the two. Online resources for marketing your exhibit as well as programming for your community or partners. Learn more about hosting an exhibit and see the full list. The link is in your handout. Someone said, I'm really enjoying building a graphic medicine collection and kit for adults and mature teens. Yes, there's so many graphic novels out there, and having a graphic medicine collection is a game changer for sure. So this AIDS exhibit is something that we can request to show. Yes, yes it is. NNLM partners with a variety of organizations to offer projects, programs, and resources for libraries. So we have StoryCorps and Citizen Science Month, and so raise your hand if you ever heard about StoryCorps. Okay, we got some raised hands. All right, so since 2003, StoryCorps has given over 600,000 people of all backgrounds and beliefs the chance to record interviews about their lives and preserve them in the Library of Congress. All Our Voices, Conversations about Health and Wellness is a toolkit for libraries and community-centered storytelling. The toolkit includes programming tools, promotional materials, and more to support listening and learning and recorded stories at the library. Citizen science or community science is participation by the public to aid in real scientific research and discovery. NNLM has developed resources and program with SciStarter, an organization focused on advancing engagement from the public in research. SciStarter maintains a directory of projects that members of the public may contribute to, so like bird and insect counts, light pollution, animal behavior surveys, gamified research on Alzheimer's disease, and so many more. Since 2016, SciStarter has organized Citizen Science Month with NNLM and many other partners. Each April, librarians, scientists, facilitators, citizen science project leaders, and many others host events and programs that engage people from all walks of life in real science that matters to them. These types of activities and events can build community, teach digital and health literacy and evaluation skills, and work to amplify stories. Providing health information through various through various formats is one way of providing health outreach. NLM has developed an online toolkit to help busy library staff host a popular and familiar library program, the Reading Club. So the NNLM Reading Club is a curated list of health-themed books from a variety of genres to facilitate conversation on health and wellness topics. By reading different health topics in a safe setting, people can learn about health information, reducing the stigma surrounded some diseases and health conditions. Topics range from menopause to diabetes, caregiving to environmental health. The topic pages have resources, videos, and fact sheets for the topic. Book suggestions include fiction, memoirs, graphic novels, young adult, and even poetry and short stories. Each book includes a discussion guide to download and social media toolkit, making it easy to host a discussion. NNLM has a variety of resources to help design and implement health programs and resources in your library. You can download free bookmarks and other materials to distribute. Browse NNLM's curated collections that feature tools and programs and informational materials from NLM, NIH, and other trusted sources of health information. Research data, outreach toolkits, training opportunities, and much more. The Public Library's resource guide is focused on health information needs in libraries, including program and collection information. Additional guides and toolkits include, but are not limited to, maternal health, emergency and disaster preparedness, and grant proposal writing. Now I'll talk a little bit about how to partner with NNLM to design and implement health programs and resources in your library. NNLM offers funding for projects that provide access to health information, increase engagement with research and data, expand professional knowledge, and support outreach that promotes awareness and use of NLM resources in local communities. 7 health sciences libraries function as a regional medical library for their respective region. If you're not ready, I recommend getting acquainted with yours. The easiest way to partner with us is to become an organizational member. Any organization that supports health information resources and services to their community can become an NNLM member. Being a member and accessing our offerings is always free. NNLM organizational members have access to funding, access to training, partnership opportunities, free educational and printed materials, NNLM travel exhibitions, and institutional recognition as a network member. Additionally, your organization will be listed in the NNLM membership directory, which leads to, hopefully, an opportunity for partnerships. The projects we highlighted earlier all receive some form of funding support from NNLM, which again, you can also access as an organizational member. Each region offers funding for various amounts, timelines, and topics. If you would like feedback on an idea, you can always reach out to your regional medical library for a consultation. Because of your extensive library opportunities, we also provide plenty of resources and support to those new to applying for an NNLM award or just new to the grant writing process in general. We have a proposal writing toolkit with lots of guidance, examples, and resources for grant writing. We also offer a yearly webinar about how to apply for NNLM funding regardless of region, and that recording is on our YouTube channel. Congratulations! This class earns 1.5 credits toward your Consumer Health Information Specialization. CHIS, which some of you mentioned in the chat, is a professional development program through the Medical Library Association, yay, that can help you gain skills in areas such as understanding your community, like we've done today. So finding and evaluating health information resources and improving health literacy. Taking a class like you did today will earn credits towards your Consumer Health Information Specialization, or CHIS. One thing that stops a lot of library staff from providing health information outreach is feeling like they don't know the resources or how to respond to health questions. This program will help you with these skills and provide recognition for them. Oh, thank you. I'm glad this was very interesting. So throughout the year, we also offer free trainings in a variety of formats, including on demand and recorded webinars so that you can take them at your own convenience. The classes are always free, remember that. There is an application fee through MLA for the specialization, but NNLM can often reimburse you for the cost of the CHIS application fee. Getting this specialization on your own or with a group at your library can be a way to boost health information offerings in your community, something your library can promote as another service to your community. I hope that you enjoy learning more about health programming for your community with others. When we take a class with lots of ideas, it can be a bit overwhelming and get shelved quickly. So I like to invite you to reflect briefly and to jot down what 3 things stood out to you, what's your next step in health programming. I'll provide a minute to let you think about that. And if you want to share, please do so. I'd love to hear from you. All right, thank you. And I'll get to your questions. Let me finish up these last couple of slides. I'm not ignoring you. So thank you for putting what stuck out to you, what you were able to glean from this session. And thank you for letting me know it was interesting and helpful. So as you know, community advocates, nurses, teachers, and librarians are trusted among the public within their families, social circles, and work. I know I have family members all the time reaching out to me to help them with finding information, and I love it. So following NNLM, NLM, or NIH social media can help you stay current with resources and learning opportunities to connect people to accurate health information. Before we can genuinely help and support our communities, we must understand their strengths and barriers and be aware that health access looks different for everyone. Also, people with a variety of backgrounds and needs are entering our libraries, and learning is a crucial way to engage with people meaningfully and kindly. I invite you to complete our class evaluation. Sam will put the evaluation link in the chat. These evaluations can help us improve the class, demonstrate the value of NNLM classes, and provide the code, and we'll provide you the code to claim your credits towards your CHIS. At the end of the evaluation, you'll be asked if you want to earn MLACE. If you say yes, you'll need to head over to MedLib Ed to claim the credit and print a certificate. If you want to stay on the call, I'll answer any of your questions. So this is a photo of a flower of a cannonball tree with a flower so carefully formed to aid in spreading pollen. Hopefully, just as this bee has picked up the pollen that can help new trees grow, you picked up a few new ideas for health programming and outreach and the confidence to cultivate them. If you're new to health programming, start small. If you're not, go for that big, bold idea. Thank you for attending. Thank you. The photo is a nice photo, isn't it nice? Okay, so I'm gonna go back up to see the questions here, and I'll stay on until 30 after the hour. Are you gonna say something, Sam?
Yeah, I was just gonna say I have some jolted down from
Okay,
for
cool.
those that put it in the chat earlier. So going back to the list of resources that was shared in the chat, I can get the links that was shared and share it after the meeting. So if there's any links that was shared amongst one another in the chat, I will share it after.
Okay,
And
thank you, Sam.
then let's see. Okay, so Valerie had a question of, do you know roughly the turnaround time between application and getting the exhibit for the NLM exhibitions?
I do not know that. I would reach out to your regional medical library to inquire about that.
Yeah, and to
I
add
mean, you
to
might know.
that,
Mhm.
there was a question also about do they have the exhibits shipped or available to Puerto Rico? I would also reach out to your regional medical library. You would be Region 2, so I would definitely recommend reaching out to them to see if they do ship it out to Puerto
Yes, because
Rico.
Region 2 supports Puerto Rico, so I would reach out to Region 2 and ask them that question if they would be able to support an exhibition in Puerto Rico.